about 20 clients within the two villages of sub-counties of Nakisunga and Kalere. So basically, I'm here to give you a brief insight about home health care program, and this is a field program that entails clients getting visited by the medical staff that comes from the health center, that is Companion Healthcare Center, which is one of the facilities under the Nabi Ministry. So we basically run this program with a clinical officer or once in a while with a doctor alongside a nurse, and then we pick our car. Race 9 a.m. in the morning up until 4 p.m. So when we get from the health center, we go with the nurse and the doctor and sometimes a clinical officer or a doctor. So these patients are always waiting, so that's why you see them sometimes into the videos or photos that we share with you on a regular basis, being excited of our coming, despite the fact that they are really elderly patients. So they're excited about our coming and they know that we are going to get to see them. Normally when we get there we do medical support as well as domestic care support. So by medical support, if I try to a little bit elaborate about this, is we go into the depth of assessing patients' conditions. Most of the patients that we have into this program are hypertensive, diabetic, they've got chronic conditions to do with peptic ulcers, severe osteoarthritis problems, and these are the most commonly problems that affect the elderly people, and these are our clients that we have into the ministry. So while we are there, we make sure that we assess their blood pressure levels as well as blood glucose levels to ensure that we refill their medications to do with hypertension and those that have got diabetes, as well as those other clients that have got arthritis or osteoarthritis, they also get their medication after assessment. So oftentimes when we're there, we do continuous treatment or we even make changes around and see, depending on the prognosis of these patients. But like you can see them, they're really excited about the visits that are done by the ministry staff or the staff that come from the ministry. And always they're so much welcoming. And these are patients that have got no attention elsewhere. Also, when they see us, when they hear about our coming, they're always welcoming and expecting us. The other thing that we do is we also do counseling. That's why sometimes the nurse gets to engage them and see what they're going through on a regular basis if we are absent, and talks to them about their condition and how to alleviate some of the conditions that do not even necessarily require medical support. We also couple that with a provision of bars of salt, a kilo of sugar, white flour, which is necessary for them to drink the porridge or make the porridge out of that, as well as other domestic care support program that we provide to these elderly patients that have got no one else to support them. So that's basically what we do onto this program. At the end of the day, we have fun with them. Sometimes we play with them or pray with them and then come.